The first step to getting out of wrist and hand pain is to simply do the opposite activity that's been causing it. Now, for most of us, we are constantly in pronation, keyboard, 10 key, whatever our job is, massage therapists, we're here, we never work here. So our hands are never in supination while at work. The first step is always going to be reverse the activity. And for the vast majority of it, we're going to start in flexion loose fist and we're going to open and go into extension. Now, as we do this, we want to work at really opening our hands and getting our fingers to go back and then our wrists to go back, open and extend. Now, the bigger you make the motion, the more you're reversing out the activity. Now, when you get out here and you turn the other way, you might get a zinger down your arm because you're actually starting to floss the nerve. So be careful with that. If after 3 to 5 reps, it doesn't ease up, this is your pain-free range. You're not adding that neck rotation to it. In the next couple days, you want to just check it. Okay, it's a little better. Okay, you can go further. And then as you go further back, you're going to get a stretch through your chest, and then you can add the neck and just work that. So this activity simply reverses what caused the problem, and it gets you on the road to reversing out the pain from the issue of life here. To take care of your forearms, you can do pin and stretch to yourself. And this depends on your mobility. But on the edge of a massage table, you can start here, stretch, come here. So I'm shortening everything by making a fist and flexing it, putting the pressure on, letting my hand open, and I'm helping go into extension. That's pin and stretch for all the flexors of the forearm. You can work this, you can flip your arm over, work the other side. You have to have a measure of mobility to get your knee to your forearm. If you can't get your knee to your forearm to do pin and stretch along these muscles, this tool is excellent for that. And you're just going to have it resting. It has a base that pivots. You're going to have it resting. This is adjustable in and out depending on how big your forearm is. You can use it on other parts of your body. So we're going to go in here, and you can see how this is narrow up here, wider here. The wider spot is going to put more pressure. So it's designed for you to be able to roll in and out. So we're working on the extensors of the wrist right now, and then we can work on the flexors. So it simply looks like this. You want to shorten the extensors, put a little bit of pressure. You have leverage now, so this left hand's not working very hard. Make a gentle fist and stretch. Release, let the blood flow in there. Put the pressure on and flex. Extend, put the pressure on, flex with a gentle fist. Release the pressure, go back. Every time you release the pressure in a pin and stretch, fresh oxygenated blood flows through the area. And what that does is it helps accelerate healing. The pin and stretch in of itself is getting those bound up, tight, stiff, and sore muscles. When you get up around the elbow, the outside of the elbow, tennis elbow area, it's going to get tender. You keep the pressure where you can handle it. Okay, we started with the wrist extensors. Now we're going to do the flexors of the forearm. The inside medial epicondyle of the elbow, that's where you're going to see people with golfer's elbow. The name golfer's elbow and tennis elbow simply are referring to tennis elbow on the outside, golfer's elbow on the inside. It has nothing to do with the sport. So here we go. We have the Rolflex device. We simply turn it around and then we put our arm back in. Now, because we're working on the flexors of the arm, we want to start the action here with them short, put pressure on those muscles, open the hand and extend. We only put enough pressure that it's not uncomfortable or unbearable. Now we're going to go in here, flex, open the hand and extend. Release. Go further in, flex, extend, open, release. Very important, after you extend, which is stretching all of the muscles that flex your wrist and close your hand, after you extend under pressure, you release the pressure so that fresh blood can flow in. So say your heart beats 60 times a minute, even if you did it 1 second pulses, that's enough time to get fresh blood in there. When you're working on the muscles of your forearm, pin and stretch, you want to get all of them because none of us have x-ray vision to see which muscle is actually causing the inflammation and irritation. That inflammation and irritation can show up as carpal tunnel syndrome, it can show up as Descartes veins, it can show up as any type of wrist and hand pain. This is just the beginning because the vast majority of muscles that operate your wrist and hand, they live here. So when you're working pin and stretch with a device like this or with your knee, you want to hit every muscle you can, 5 to 10 pin and stretches in each spot, and you want to do it in such a way that it doesn't hurt, doesn't take too much time, and that you don't end up being bruised the next day. So you want to start easy, start completely pain-free, and move from there. The results will be quick. You will have relief within the first day or two. This is a nerve flossing series, and we're going to start with the ulnar nerve, which is responsible for that activity. Then we're going to do the median nerve, which is palm up, down, and then the radial nerve is palm down. So to get into the ulnar nerve, we're just doing this. And if it is involved, you may only be able to get to here pain-free. So you want to test it a couple reps to where you're like, ooh, I have a zinger somewhere along the line, because ultimately the nerve exits the cervical vertebra or the bone in your neck and then comes through the brachial plexus, feeding the arm and hand. So if you're only here now, that's okay. Ironically, this is the okay sign. Now, if you get better in that first few reps, you can keep going for about 10 to 15 more. You don't want to overdo it early on. The nerve is irritated because it has tension along the path, and we're just flossing that path to create space and freedom. We're giving the brain the signal that it is okay to move again. So here we're going to be down here, come up, all the way rotate. Can we do it? Okay, good. We're good there. No issue there. Next, we're going to do the radial nerve. The radial nerve is palm down. So we're going to be away and palm down. So we can come close, far, palm down. If you want to add stretch, you turn your head and side bend. Now, if you have issues stemming from the radial nerve, you might not be able to move your head at all. You might have to have your hand out in front of you. If you don't have issues that bad with the radial nerve, you'll be able to go palm down with your arm back, chest open, turn away, and side bend, and you'll get that nerve floss there to maintain health there. So that's the radial nerve. So you're going to go short, far, stretch, pain-free range, turn the head, side bend. If that's okay, that's where you work. Now, if you go short, far, palm down, flex the wrist, turn away, and that's still okay with the side bending, then you can go back to lengthen the entire nerve from its root to its ending. This is the median nerve floss. This is probably the most common nerve that needs flossing, and this is what you would get carpal tunnel involvement with, the median nerve. Now, anytime you have nerve pain, nerve involvement, know that it is not where you feel the pain. At best, it's coming from somewhere in the forearm. These muscles get overly tight from being pronated with the wrists flexed. A tight muscle is a short muscle, and a short muscle is pulling on tendons. When the tendon sheath swells, it closes off that carpal tunnel, and that median nerve that runs through with all the tendons and vessels gets pinched off, hence the sensation. So we're going to go over the nerve floss for the median nerve, and it's simply with your palm up, and you go out as far as you can, pain-free, and pull your hand down. So you're going into wrist extension here with your palm facing the ceiling. As you go further, so you might start with your palm straight out in front of you. That's fine, no issue. Check, 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 until you're all the way here. Now you might get some signal like, ooh, that stretch just got real. Shorten, check, shorten, check. 3 to 5 times. If it improves, then you can go further and open up that pathway, opening up the chest. Now, if you're here and you feel the stretch and you go side bend with the head, so this is short, lengthening, 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 that is how you floss the median nerve. If you want to go further, you're going to just bring your arm back further, turn, and then go away. So we're creating as much length through the system, pain-free as possible, to keep it healthy and happy so that this activity doesn't bother you.